The double chin, a big, huge problem. I can talk about a double chin for days, but today we're going to talk about the muscles involved in a double chin. Now, we have our neck, which has a muscle, which is called the platysmal band. Now, if I do this is my platysmal bands, right? I Botox my platysmal band because sometimes they stand up. And the platysmal bands are very strong. Now, if I lift my chin a little bit, or go to say, and I tighten my platysmal band, you will see that I have it protruding here. And when these bands get tighter and it protrudes out, they can actually help to cause a double chin. So when I see persons that come to me to get rid of a double chin, I always ensure that I Botox the platysmal bands first, which is a very superficial treatment, and that the platysmal band release the neck, and then I treat the skin and whatever fat that is underlying. Double chin is pretty difficult to go. Sometimes you treat a person, it doesn't help much, or the skin is not elastic enough so it doesn't snap back. So sometimes you have to do multiple treatments, sometimes you have to do repeated treatments. So depending on who you are, be patient. Of course, the best thing to do is really have surgery, but some persons don't want to have surgery to really lift the double chin, but you can have a surgery, a lower facelift. But the non-invasive procedures can take time. You may have to repeat it. We're talking about PDO threads, etc. Now I have endolift, which is like magic, which is a laser that goes on the skin. So that's amazing. But at the end of the day, if we have that double chin, we have to take into consideration the platysmal bands and treat the platysmal bands before we look at anything else. And there are a lot of things that come into the double chin, but your platysmal bands is a big part of it.